Katie Chambers still here, keeping you updated on everything to do with the weather news, the traffic, with this impending wet weather that we're due to see over the next 24 to 48 hours. The National Centre of Meteorology said that we're due to expect a maximum of around 45 millimetres of rain. Just to put that in perspective, during April 2024 flooding, Dubai received 142 millimetres of rain in 24 hours. So it's definitely not going to be as bad, we're told, as April 2024. But we are going to keep you updated, as will the ARN News Centre. Another story we want to keep you updated on is a warning from doctors about a new aggressive flu variant that's spreading fast across the world. Hospitals in Europe, Australia, North America, where my family are from in the UK, they say that hospital admissions, are at breaking point with this virus. They're reporting, earlier, more intense outbreaks than usual. Like I said, in the UK, flu-related hospital admissions are up 55% in just the last week. In Queensland, in Australia, cases have surged past 95,000. And here in the UAE, clinics are seeing a rising concern among families, as people are travelling and spreading the germ love that we do when we move around the earth. My friend was actually at an emergency department yesterday evening that was extremely busy. Reportedly, 30 cases of flu were in the emergency department alone. So it just really puts it in perspective how many people are being affected by the virus this year. So what do we need to know? Who's most at risk, and how can we tell this apart from, a regular cold or kind of the regular flu that we get? Joining me now on Microsoft Teams is Dr. Lucia Nirmalanayagam. She's a consultant in family medicine at NMC Royal Medical Centre, The Palm.
It's Lucia Nirmalanayagam. I married into that surname. It took me 6 months, so no offence taken.
Thank you, Dr. Lucia. Thank you. Well, thank you for joining us. For a start, tell me about the new flu strain we're hearing about. How different is it from the regular seasonal flu?
So we have to appreciate that the influenza, we have it every year, and the strains vary from each year to each year. And this year, this new strain has been taken account for most of the cases. And the reason that we're seeing such a rise in the number of cases is probably because it is more contagious. And so it's really important to think about how we can protect ourselves from getting the flu to begin with, and then when we do get it, knowing what to do. So to protect ourselves, the flu vaccine is a big one that we must think about. And if it's something we're not aware about, or not sure whether we should be taking it, please do speak to your doctor.
Yeah, I mean...
So with regards to...
No, you carry on, Lucia.
So with regards to the flu vaccine, you mentioned in your introduction earlier about the nasal flu vaccine, which is brilliant, especially it's a pain-free way of giving to children from the age of 2 and above. You can actually use it up to candidates up to 49 years of age, as long as they're fit and healthy and don't have a low immunity and they're not pregnant. The flu vaccine, the one that we all know about, which is the jab, this one, again, the side effects are very minimal and the impact is vast.
Yes, I mean, they're both really good. We've had the nasal vaccine in the UK for many, many years now. They just line the children up at school. You go into the library and they, put it up your nose and Bob's your uncle, you're done. This new variant, is it covered by the existing vaccine?
So what the World Health Organization have said is that the vaccine that they provided for this year, there isn't data to suggest that it definitely covers it, so it prevents you from getting the infection. But what they have shown is that it does reduce hospitalization. So by that, what I mean is that if you were to get the infection and you have had the flu vaccine, you're more likely to recover better and avoid needing to go to hospital, like you said, how your friend was sitting in the emergency department with many other people presenting. So with regards to the flu, it feels horrible. And one of the best ways to describe it is that it feels like you've been hit by a bus. The pain, the body aches, the chills, the fevers, it's significant. I would strongly recommend the flu vaccine because although it may not necessarily completely protect you from getting the infection if you were to expose to it, the impact from that infection will be limited.
Okay, so that is really, really reassuring for my family. We've all had the flu vaccine, so we are pretty militant at, making our children have it. We get it complimentary with my husband's medical, but only the injection. So I was that mum that marched them off, even though there was the nasal one available. I didn't want to pay for it. So we had the flu vaccine instead, the injection one, yeah.
So there's just a couple of things, because compared to the UK and here, it's a big learning curve to understand how the health system works in the UAE. And one of the things that I have been doing is, so you've got different cohorts of patients. You might have patients that don't have insurance, so they're paying cash. And it's worth always having a look around, because here at NMC, we appreciate the importance of the flu vaccine. So we'll provide a package around it so that the patients do benefit from it as much as possible. Then from an insurance perspective, often you're not aware of what is covered, and that includes flu vaccine. So if I see somebody, every opportunity I see someone, I ask them, would you like the flu vaccine, and try and educate them as much as possible. Now, often some patients may know that the flu vaccine is covered under insurance. The others may not know. And what I do in those cases is I actually request from the insurance, please, can I provide the flu vaccine for my patients? And if I get approval, which is within 2 weeks, then they can have the flu vaccine. And if they wanted the nasal or the injection, I will apply for the one accordingly. And I have had it approved for patients. Some insurances, as they will allow us to do the vaccine and it's covered. Some will let us know that we do the vaccine, but it's the patient then has to pay and then get it reimbursed, and they have received it.
Pay and claim, yes. I mean, I'm
yes.
of the camp, there's no excuse. We just have to please have this vaccine. It's there to prevent us getting... I remember having it once and my eyeballs hurt. It was so awful, and it's not just the week you're in bed, it's the month after that you're recovering from it. I mean, how many patients have you seen in the last month presenting with flu-like symptoms?
I can't give you a number, but it is a lot, a lot. And every patient that falls into that category, we do test them for the influenza, and we are getting a lot of influenza strain the A. How they are, to be honest, because we've seen so many, when you literally look at the patient, often you can kind of tell that they have the infection, and then the test just confirms it. And I've heard the same from my colleagues also at other hospitals. So, yeah, I can't count it.
No.
It's a lot.
And it was just serendipitous this morning. My friend had to take her daughter to A&E last night, and she was like, there was 30 or so people in the waiting room all presenting with the flu. And she's a bless her. She's a little bit scared of viruses anyway and things like that. So it's not great. Just returning to this new variant, how worried should we be about that? Are the symptoms worse with this new variant? What should we be looking out for?
So the World Health Organization, they haven't said that the severity from this infection is worse than the other influenzas, is the first thing. But because the number of cases have rapidly increased, that portrays that how infectious the actual infection is. And so because there's been a sudden increase in the number of cases, this is what then has impacted the health system, and suddenly there's a high influx of patients. Just with regards to numbers, for example, this year, we peaked at about 30 to 35% of our tests coming positive in, I think, mid-November. When you compare the data to last year, the peak was reached around mid-December. So you can see that the peak was reached much higher than previously, firstly. And secondly, the peak that we reached this year is much higher than last year. So last year, the number of tests that were completed, of those 20 to 25% were positive at the beginning or middle of December. So we've peaked earlier and we've peaked rapidly is the key thing here. I had a quick look through data, and I could see back in 2022, we had a similar kind of picture, and we ended up with two big peaks. So I guess because this is so contagious, the concern is that we're going to be going through quite a tough flu season where everybody will be passing it on, which then will put strain on the health system. So to help protect ourselves is key. And when we do get the infection, to make sure that we are not going out and about, we're isolating, or if we do have to go to the hospital, we wear a mask. Vigilant hand washing, protecting the ones in our households as well. I hope that makes sense. Yeah,
it really, really does. Yeah, don't spread the love if you've got the flu. I think that's probably the main consensus and advice there. Those figures you just gave us, Doctor, are they for Dubai or are they for the UAE? When you were saying about 35%, we've hit the peak earlier.
So that is from the World Health Organization, and that's the Eastern Mediterranean region figures. So it doesn't cover just Dubai or UAE, it's the whole area. But when you look at specifically UAE, I couldn't see the specific data, but you could see in UAE the number of influenza cases that we're getting positive. The majority of those are the new strain.
Okay, thank you. That is so good to clear all that up. Please, it's never too late to get the flu vaccine. We're still knee-deep in flu season. Thank you so much for joining me. I'm going to call you just Dr. Lucia rather than your surname, if you don't mind. You're a consultant in family medicine at NMC Royal Medical Centre, the Palm. Really good. And, we're peaking earlier. So please, if you've got spare time, if it's covered by your insurance, go and get that flu vaccine. You need to help yourself and also help others.